Hi everyone, this is Divya from Quick Mommy Hacks, and today we have Dr. Catherine Hall to talk about vaginismus and pregnancy. So, Dr. Catherine Hall, she's a licensed psychologist and a certified sex therapist. She has a PhD from McGill University in Montreal, Canada, and she is also the president of the Society of Sex Therapy and Research. She runs her own private practice in Princeton, and she specializes in the treatment of individuals and couples who have sexual and relationship concerns. She's an educator with over 30 years of experience and has authored numerous scholarly articles and books, including a 2006 Star Consumer Award winning book on female sexual desire, Reclaiming Your Sexual Self, how you can bring desire back into your life. And she's also the co editor of Principles and Practice of Sex Therapy and the Cultural Context of Sexual Pleasure and Problems, Psychotherapy with Diverse Clients. Hi, Dr. Hall, how are you?
I'm well, thank you.
So, thank you so much for joining us to talk about vaginismus and pregnancy. It's great to have you.
Thank you. It's nice to be here.
So, Dr. Hall, my first question is what is exactly vaginismus and why should we know about it?
Well, vaginismus is a sexual disorder. It's actually quite common. And it's a disorder in which there's significant muscle tension that occurs in the pelvic floor, in the muscles that surround the vagina. So when someone has vaginismus and the muscles become so tense, it can make intercourse impossible and very painful.
So, how does one know that they have vaginismus?
Well, you might not know you have vaginismus until you try to have sexual intercourse or until you try to, put something in your vagina. So a tampon, for example, during a menstrual cycle, or even sometimes it can be detected, well, it can be detected during a routine gynecologic visit when the gynecologist attempts to put something inside the vagina. But you
Okay.
otherwise wouldn't know you had it.
So, are there any other names for it?
Well, it's also been recently renamed as genitopelvic pain penetration disorder, which
Mm-hmm.
why the name was changed was to reflect the fact that sometimes, well, vaginismus refers to a vaginal spasm that occurs, preventing intercourse. Sometimes there's actually no spasm, there's just the muscle tension that's there.
Mm-hmm.
Sometimes there's just significant fear or disgust around the sexual activity, which prevents, the fear is so great that it prevents any attempts from happening. So that's why the name was changed to
Mm-hmm.
broaden, the category.
Mm-hmm. So, are there different types of vaginismus and what are they?
So there's two types of vaginismus, primary and secondary.
Mm-hmm.
Primary vaginismus is when the problem has been present from the time that the woman was sexually active, first
Mm-hmm.
sexually active. So it's
Mm-hmm.
always been there. Secondary vaginismus is when there's been a period in which sexual activity was possible,
Mm-hmm.
but then something happens and there's vaginismus after that. The
Okay.
most common form is primary,
Mm-hmm.
but secondary vaginismus does occur when there's been healthy sexual functioning and then all of a sudden there's a problem.
So you talked about the physical problems associated with vaginismus. So is the manifestation of vaginismus based on some psychological problems as well? And if so, how?
Well, so just to repeat a little bit about the physical problems, I mean, for both the psychological and the physical, there's the muscle tension,
Mm-hmm.
but that can be triggered by, inflammation. It can be genetic in the sense that
Mm-hmm.
there's extreme sensitivity just genetically there. It can be triggered by an infection, that sort of thing that causes pain. But also there's psychological problems that
Mm-hmm.
can result in this muscle tension. So someone who has, really significant fear and anticipates pain with intercourse, the muscles can involuntarily spasm, causing vaginismus and preventing intercourse. Sexual trauma can contribute to or cause
Mm-hmm.
vaginismus.
Mm-hmm.
So yes, there's significant psychological problems, especially if someone doesn't really know very much, hasn't got very much such sexual education and is therefore more fearful than knowledgeable.
So by sexual trauma, you mean some kind of abuse or some kind of history with sexual trauma?
Yeah, so childhood sexual abuse can
Mm-hmm.
be one, even if and there can be physical trauma, of course, an injury to to the genital area, but there's also just, the fear that a sexual trauma is going to happen can also trigger it.
Mm-hmm.
The tensing of the muscles, the desire to maintain one's virginity can also contribute to it. So it can be actual sexual trauma, fear of sexual abuse, a physical injury, or again, like psychological uh, injuries to oneself.
So you mentioned about like the sexual trauma and the abuse and everything that could also be a cause of vaginismus. So once a woman has already gone through the sexual trauma and everything, and if she has vaginismus, then how does it really affect her state of mind further? Does it affect her self-worth or her relationships?
Well, if it's related to sexual trauma, it of course reminds her of the sexual trauma. It makes her feel damaged by the sexual trauma, and this is very devastating. Right? So it's an ongoing reminder that I have been hurt or injured, and now I can't do something that, what she believes other women can easily do.
Mm-hmm.
So it affects the self-esteem, of course, as well. So it's a
Mm-hmm.
re-traumatization. It affects self-esteem. It also, her partner may not understand what's
Mm-hmm.
happening. And if he doesn't understand that it's not voluntary, the spasming and the tension is not voluntary, he can be upset, feel rejected, angry. So there's a relationship tension, distance. Relationships can even
Mm-hmm.
break up. So it's a shock usually to both people.
Mm-hmm.
Most people assume that women can do this.
Mm-hmm.
So
Yeah.
it's a shock to both. And
Yeah.
if they don't know what's going on, it's because the spasm and the tension is involuntary. She's
Mm-hmm.
not doing it on purpose. It just automatically
Yeah.
happens.
Mm-hmm.
And so, yes, it can, to the partner, it can feel like a rejection. And so there can be a distrust.
Mm-hmm.
And for her too, there can be a distrust. You're going to hurt me. I can't trust you that you're not really going to hurt me.
Mm-hmm.
So it can keep cycling.
So is it treatable? That is the question. And like, who should you go for help, if you're suffering from vaginismus?
The very excellent news is that it's a very treatable condition.
Mm-hmm.
And who you should go to depends on, of course, who you have access to. Most women will probably go to their gynecologist first.
Mm-hmm.
And I would have to say that unfortunately, there are some gynecologists who are not familiar with this problem.
Mm-hmm. Mm-hmm.
Right? So you have to go to somebody who's knowledgeable. If you go to someone and they say, I don't know why you have this problem, I don't know why you can't have an examination, then you have to go to someone else.
Mm-hmm.
Ask them, do you know about vaginismus? A
Mm-hmm.
psychologist or a therapist or a counselor also can know about it, but would have to be someone who has some expertise in sexuality. They would
Mm-hmm.
also likely be able to know about it and help you. Um, you may also get a referral to a pelvic floor physical therapist who
Okay.
can also help with the problem.
So since this is something in which, both the partners are involved, so how do you actually bring your partner into it? Like when you decide to seek treatment for it, how do you bring your partner on board? And, how specifically like it affects the partner's state of mind as well?
Yes, so I think, partners should be invited to the
Mm-hmm.
treatment because it will help him understand what is going on and not feel so rejected, would help him feel hopeful. And
Mm-hmm.
also, many sensitive partners are worried that they're going to hurt
Mm-hmm.
their partner. So they don't want to. They're afraid and fearful too of causing pain or fear or hurt. So treatment will help them understand how to be able to have sexual intercourse without causing the pain.
Mm-hmm.
So the earlier in the treatment process they can be involved, the better.
Mm-hmm.
So they can attend a gynecologist appointment, or if it's counseling, especially, they can come to a counseling
Mm-hmm.
session and be involved in that.
So, is there a lot of shame associated with it, like with women accepting that they have this problem and then like seeking the treatment for it?
The most shame comes when they have the problem and they don't know what it is.
Mm-hmm.
Okay.
Okay.
When anyone has a sexual problem, it's very devastating to them. Our sexuality is part of our identity, who we
Mm-hmm.
are as women. It's also, it prevents something from happening that could prevent you from getting pregnant. It can
Yeah.
prevent a marriage from being consummated, from actually,
Mm-hmm.
feeling like a real marriage. So
Mm-hmm.
it's a tremendous source of shame.
Mm-hmm.
And that shame, as you were mentioning, can make people keep it a secret. I can't
Yeah.
tell anyone, no one
Mm-hmm.
will understand. And so they don't get help for it when it's a very treatable condition.
So, what is the course of treatment in terms of to address the physical and also the psychological problems?
Yeah, the best treatment is a combination of psychological treatment and physical treatment. And, a psychologist or a therapist, a sex therapist, can help you do both.
Mm-hmm.
So sometimes so the treatment requires both working on why you have this problem, the
Mm-hmm.
fear, resolving the trauma, dealing with the shame, feeling more confident. That's part of the psychology of it. The physical part is there's doing some gradual exercises that help to relax the muscles
Mm-hmm.
and help the vagina become more elastic and expansive, which is what it's supposed to do,
Mm-hmm.
right? In response to normal relaxation and sexual stimulation.
Mm-hmm.
Sometimes this involves dilators. Sometimes you go to a physical therapist, or a psychologist, sex therapist can help you do
Mm-hmm.
some of these things at home in the privacy of your own home or with your
Okay.
partner's help.
So, coming down to pregnancy, so is it possible to become pregnant with vaginismus?
It is possible to become pregnant with vaginismus. It's more difficult, of course, but
Mm-hmm.
yes, it's possible to get pregnant when you have vaginismus if the ejaculation occurs right at the opening of the vagina.
Mm-hmm.
Sperm can still get inside. It's
Mm-hmm.
possible.
And is it possible to give birth vaginally if you're suffering from vaginismus?
Yes, it's possible. Most women are very terrified of that possibility when they
Mm-hmm.
have vaginismus. But it is absolutely possible because vaginismus affects the outer third of the vagina. So that's where the
Mm-hmm.
pain and the tension happens. And
Mm-hmm.
of course, when you're delivering a baby, the whole process goes in the reverse direction. So it's a very
Mm-hmm.
different physiological process. It's very possible to have a successful vaginal delivery with
Okay.
vaginismus.
Mm-hmm. So, in your opinion, is vaginismus related to infertility? I mean, can it be one of the causes of infertility that many people like don't know about?
Yes, sexual problems in general are a significant cause of infertility.
Mm-hmm.
So, vaginismus will affect fertility by the fact
Mm-hmm.
that it prevents the most, efficacious form of
Yeah.
of
Mm-hmm.
fertilization.
Mm-hmm.
Yes.
So, is vaginismus cured once you are able to deliver? Does it
No.
ever go away? No?
No, vaginismus is not cured, unfortunately, by a vaginal delivery, which surprises many people. But it is a different process, and it affects, vaginismus affects the outer part of the vagina. And so
Mm-hmm.
that it's an involuntary spasm when something approaches or is near the outer part of the vagina.
So, Dr. Hall, you mentioned that some of the OBGYNs they don't know about vaginismus. So, for example, if you have a doubt that you have vaginismus and you're going for a gynecological exam, so how you should approach your visit?
Yeah, that's a very good question because at some point, if you suspect you have vaginismus, you are going to need to go to a gynecologist because you want to rule out any physical causes. Is there an infection or an inflammation or any damage to the area that you need
Yeah.
to be
Mm-hmm.
mindful of? And so you are going to need to go to a gynecologist. And if you can start the exam by asking that question. I'm concerned I have vaginismus. Can you do an examination? And if the doctor's never heard of it, you may want to stop the exam right there and ask
Mm-hmm.
them to either find out about it or be referred to someone else. But if the exam is ongoing and it's causing you pain or fear, um, stop the examination. If you're not comfortable, just stop the examination.
Mm-hmm.
And, again, ask either for a referral for someone else who might know about this, or for the doctor to take it more slowly and do it in steps,
Mm-hmm.
right? So a gynecologist who knows about vaginismus will often take several appointments
Mm-hmm.
to help you feel more comfortable with the examination, with the instruments that are used, and we'll start with very small
Mm-hmm.
instruments,
Okay.
used usually for children. Well, a lot of people think that women have that the hymen, which is
Yeah.
the which is kind of a protective skin around the vagina. They think it's like maybe my hymen is so like my hymen has to be broken,
Mm-hmm.
right? Which makes them feel pain, like as if it's a covering that completely covers the vagina, which is not true. And so it's rarely the case, and a gynecologist will see this, but it's very rare for there to be a hymenal covering the
Mm-hmm.
entire vagina. And so there's nothing that has to be broken in order to have intercourse.
So, Dr. Hall, as you mentioned, like type 1 vaginismus, the first kind, happens usually in the women who are attempting to have intercourse for the first time. So, is it very
Mhm.
specific to, or does it affect certain ethnic populations?
Women from all walks of life can have vaginismus.
Mm-hmm.
Where we see the problem occurring most often among women is women who are trying to make a transition from um, a culture in which their virginity is um, seen as very necessary, must be guarded, it's highly valued, and they don't have very much sex education prior to their
Mm-hmm.
first intercourse. So making that transition from no sexual experience and guarding your virginity to all of a sudden, being sexual, that often creates the problem where vaginismus can occur more frequently than in other groups of women.
So, lastly, do you have any words of advice for women who are suffering from vaginismus? I mean, those who don't know about it and those who know, but as you said, it's not cured. So, what can they do in order to, probably forget about the fear and, have a healthy relationship?
Well, you're not going to forget about the fear because it's going to be with you. But I think, having a more hopeful attitude, right?
Hmm.
Not feeling ashamed of it. This is not something you're doing or not doing. It's
Hmm.
something that happened to you that caused this problem to occur, and you
Hmm.
need to get treatment. So be hopeful. Don't keep trying over and over again the same thing, right?
Hmm.
It makes you feel depressed. It makes you feel hopeless. It can create problems with your partner to just over and over again feel that
Hmm.
you're failing. And then it can affect your whole sexual relationship and your
Hmm.
intimate relationship too. So don't just keep trying, seek help. To also the thing to do while you are waiting for treatment or while you are waiting for the treatment to be successful is to not avoid all intimacy or all sexual intimacy with your partner. The
Hmm.
healthier your relationship is and the more enjoyable the other aspects of sexual intimacy are, the better the resolution will be.
Mm-hmm.
So, other sexual activities and certainly affection are extremely important.
Do you have any message for the partners?
For partners, I think the idea is, to be understanding, to
Mm-hmm.
try not to feel rejected.
Mm-hmm.
This is not something your partner is consciously doing.
Mm-hmm.
And to be involved and as involved in the treatment as you can be, because your partner also has to have faith and trust in you
Mm-hmm.
once they are proceeding to intercourse, that you know what you're doing and you're not going to hurt her. And the
Mm-hmm.
best way you can get to that point is to be involved in the treatment right up to that point.
So thank you, Dr. Hall. Those were like really great suggestions, and I'm sure listening to your words of advice, it'll be really helpful to women who don't know what vaginismus is or who are trying to figure out and trying to seek treatment. And also it'll be very helpful for the partners and people in that relationship dilemma of like what is happening. So it's really great. It's a pleasure to have you.
Thank you.
Thank you for watching. If you liked the video, subscribe to my YouTube channel, Quick Mommy Hacks, and follow me on Instagram for some personal tips on pregnancy, childbirth, and motherhood. Also, do leave your feedback and feel free to ask questions in the comment section below. I would love to hear from you.